Good evening. Thanks so much for joining us. My name is Rochelle Steele, and I'm here at Memorial Care, Long Beach Medical Center, and Miller Children's and Women's Hospital, Long Beach. Thank you so much for joining us. We know how important this discussion is to our community, so we're thrilled to be able to bring together our Children's Hospital, our city's health department, and school district to answer some very important questions about COVID, the vaccine, and going back to school. We received an overwhelming number of questions ahead of time, so as soon as I introduce our panelists, we'll get right to it. We'll also be monitoring our chat for questions throughout the hour, but we do only have an hour, so we'll do our best to get to everything. But if you submitted a question in our chat and you don't hear an answer this evening, we're going to make sure we follow up with you directly or via our social media. So we appreciate you understanding, and we're going to do the best we can. So without further ado, I'd like to introduce our panelists. I'll start with Dr. Graham Say. He's the Chief Medical Officer for Miller Children's and Women's Hospital Long Beach. He's also our physician in charge for COVID for both of our hospitals here, Miller Children's and Long Beach Medical Center. Dr. Graham Say has served at Memorial Care Miller Children's for more than 20 years, and in 2017 added an administrative role to his responsibilities when he became Chief Medical Officer. He's board certified in pediatrics and pediatric critical care. He's held numerous leadership positions and gained extensive teaching experience at Miller Children's. During the COVID-19 pandemic, he has served as our physician in charge for both of our hospitals. So welcome, Dr. Say.
Good evening.
And then next, Dr. Anissa Davis. She's the health officer for the city of Long Beach. Dr. Anissa Davis grew up in Long Beach. She obtained a BA in history at UCLA, then attended Stanford School of Medicine, graduating in 1998 with her MD. She returned to Long Beach to complete a residency in family medicine. She then completed a master's in public health at UCLA in 2002 and worked for the Long Beach Department of Health and Human Services as a public health physician specializing in biological bioterrorism agents from 2002 to 2005. In 2005, she left the city to begin a career in Los Alamitos as a family physician, providing primary medical care to adults and children, which she did for 11 years. She returned to the Long Beach Health Department in September of 2016 as the city health officer. She's married and has two wonderful sons. She loves reading and all things books, which you can tell from her background in education. And last, I'd like to introduce Dr. Tiffany Brown, the Deputy Superintendent for Long Beach Unified School District. Dr. Tiffany Brown is the Deputy Superintendent for the school district. She's beginning her 26th year in the school district. Dr. Brown's career began in the district as a school psychologist. She has been an administrator for the last 18 years and has a background in student support services, special education, emotional wellness, and health. In the last year, Dr. Brown has been the primary point of contact between the school district and the Long Beach Health Department. Thank you all for joining us. And I think you'll all agree that they're a perfect set of panelists for this topic tonight. So we really do appreciate you all taking the time this evening to sit down with us. So we do want to get right to the questions. We had a whole slew of questions come in that ran the gamut from asking about COVID, asking about vaccines, and a lot of questions, of course, about schools and getting our kids back into the classroom. So we'll start with a few questions that are just kind of background on where we are with COVID. So Dr. Davis, I'm going to start with you. According to the CDC, 97% of the people hospitalized from COVID-19 were not vaccinated, and 99.5% of COVID deaths are among unvaccinated people. How can the vaccine prevent death and hospitalizations?
Hi, thank you so much for having me. Good evening, everyone. So all three of the current vaccines that we have available in the United States, which are Pfizer, Moderna, and the Johnson & Johnson vaccine, are all very effective in preventing both infections and hospitalizations and deaths. So they're greater than 80% effective at preventing infection and greater than 90% effective in preventing hospitalizations and deaths from COVID, from the virus that causes COVID, including the Delta variant. So it works very well against the Delta variant. And just as an example, so in the month of July that we just finished with, July 2021, our cases were equivalent to what they were in November of 2020. But in November of 2020, there were 20 deaths and 111 hospitalizations. And comparing that in July, when we had the similar number of cases, we only had 6 deaths and we had 65 hospitalizations. So it just shows you that the vaccines are all very effective in decreasing your risk of hospitalization and death, which is really what we wanted the vaccines to do.
Definitely, that's great. And then a question that still seems to be coming up, do the COVID-19 vaccines modify our DNA?
The COVID vaccines, none of the 3, none of those vaccines modify the DNA. So they do not modify our DNA. So the vaccines are basically all just little pieces of little instructions or material that are telling our cells to make one little protein part of the virus. So it's not the entire virus, it's just one little protein. It's just enough to convince our cells or trick our cells into thinking that they've been infected with the entire virus. And then they basically mount the immune response, which includes making antibodies, which are just kind of like the army of the body that we use to fight off the virus if we actually do come in contact with the virus. So what that little material does is it goes into our cells, but it doesn't even go into the part of the cells where our DNA is. Our DNA is kind of tucked away in this special part of the cell called a nucleus, and the vaccine doesn't even get into there. It just kind of takes over our cells, tells our cells to make this protein, and then it just degrades. It doesn't even stay around for very long in our cells at all. So it's not having any interaction with our DNA.
Okay, wonderful. And then one more question about COVID. What are COVID variants and why is the Delta variant more severe?
Yeah, so basically a variant is still the virus, but it's undergone some mutations or some changes. So when you're infected with a certain virus, and these are all different kinds of viruses do this, it has to multiply in order to make you sick. So you get infected with it into your body, it starts to make a lot of multiplications of itself, and that's what makes you sick. And that multiplication process is kind of sloppy, so it makes a lot of mistakes as it's multiplying. And what can happen is just by chance, you can get these mutations that end up making the virus more contagious, which is what happened with the Delta variant. So the Delta variant is at least twice as contagious as the previous variants or types of the virus. It looks like maybe it is more severe as well if you do get infected with the Delta variant. But the big thing is that it's much easier to get. So whereas with the kind of parent virus, you know, if you had it, you might infect 2 other people if you weren't using all the precautions. Now with the Delta variant, you can infect up to 7 people. So it's just, you know, really, really strong and easy to pass around. And that's why combating it is so important, including, you know, vaccination, wearing your mask, and those types of precautions.
Absolutely. Okay, we're going to move to Dr. Say with a question specific about children. When will vaccine be available for children under 12? It's a 2-part question. And are the vaccines even safe for children?
Good evening, everyone, and thank you so much for having me. Everyone is eagerly awaiting when the next age group is going to have approved vaccinations. So Pfizer has stated that they will submit vaccine safety data to the FDA by the end of September. Moderna has stated they will submit the same data or their data to the FDA by the middle of the fall. Ultimately, it's up to the Food and Drug Administration to review the data and determine if it is if they will grant authorization after they've reviewed the data and the safety. We are hopeful that vaccines for the age group of 5 years to 11 years old could be authorized hopefully by the end of this year if not, hopefully in the very early part of 2022. For those under 5 years of age, the timeline is a little less certain, hopefully would soon follow afterwards sometime in 2022. Just reminding everyone that currently the Pfizer vaccine is approved for those 12 years and older, encouraging everyone to get their vaccine. It is the same vaccine as given to the adults and has undergone the same extensive testing, studying, and scrutiny in the above 12-year-old age group as the adult population. And the bottom line is, for those 12 and above right now, the vaccine is absolutely safe for children to receive.
Wonderful. Okay, Dr. Brown, we're going to move over to schools. We know that this is a really hot topic right now. I've seen a lot of back-to-school pictures on social media already, so kids have already started. So we have a few questions for you here. The first one, it seems the COVID-19 variants are infecting younger populations. How will our schools protect our students who are not yet eligible for the vaccine?
Good evening, everyone. It's a pleasure to be with you. Thank you so much for allowing the school district to participate. So we had the fortune of learning a lot from the number of students that were in our schools in the spring, and to have served about 14,000 students during summer. There have been some great lessons learned in having students on our campus, and we will be continuing to use all the prevention or mitigating measures that we've learned to be effective, to include mask use, regular hand washing, regular sanitation in our classrooms, as well as much distancing as possible. And social distancing is not a requirement now, but we will be absolutely working to spread students indoors as far apart as classroom space will allow. Our priority will be to have as many students in person as possible, but we will be working to spread them out. And then the other message to the community is just the importance of keeping students home when they're ill. That's one of the things that we learn, is that one of the greatest preventers is to not come to school when you're symptomatic. So those are some of the things that we will be continuing to do as we welcome students back on August 31st.
Great. And then just kind of a follow-up to that, is there anything different that you all will be doing, since the Delta variant seems to be much more transmittable, a higher rate? Is there anything different that you all will be doing?
We'll be continuing to encourage the things that we've seen work, which are the measures that I just mentioned. And then the biggest message that I want to reiterate, and something that was a challenge during the large group of students that were in our summer schools, is that we need students to stay home when they have symptoms. What we've learned is that the exposures that we had during the summer came through students coming to school ill. And so we want to really, and supportively but strongly, message to our community that this is not a time to come to school ill, having not had a COVID test and really knowing what's happening inside your body.
Okay, thank you. One more question for you. For this round. Last year, there was a plan in place to test all students weekly until our community reached a certain case threshold. Our case count is currently much higher than last year, yet we do not seem to be implementing this testing. Is there a plan to test students and staff as numbers go up?
So regarding students, surveillance testing is something that we continue to be in conversation with. And as the day draws near, we'll be making a determination based on our consultation with the health department, who have been great partners to us through this very long stretch of 18 months. So we will be continuing to be open in dialogue about that. If school were to begin tomorrow, we would not be surveillance testing, but we will closely collaborate with the health department as the weeks go by. And then for staff, it is commonly known, but we will be requiring vaccination or a test that is weekly that indicates if the person has COVID.
Okay, thank you. Dr. Say, we're going to come back to you for a couple questions. So this one is, my son is severely allergic to peanuts, tree nuts, shellfish, and citrus. He is not yet old enough to get the vaccine, but when he is, would it be safe for him?
Great question. Many individuals who've had a history of life-threatening reactions or anaphylaxis to peanuts, tree nuts, specific foods, and bee stings have safely received these vaccines. Those kinds of allergies are not contraindications for getting that vaccine. People with these common allergies absolutely can get safely receive the COVID vaccine, and many already have. All individuals are observed for 15 to 30 minutes after they get the shot for any type of reaction. However, if your child or yourselves have ever had a prior severe allergic reaction to any vaccination, discuss it with your healthcare provider.
Okay, thank you. And one more, Dr. Say, are children under 12 who are at high risk due to underlying conditions putting their lives and health at risk by going back to school in person?
Another great question. So there's a tremendous spectrum of underlying conditions, and some of them could pose a higher risk for the child if they were to catch COVID than other conditions. And the other side of the coin is, and what's very important is what prevention strategies the school or facility is using to prevent transmission, whether that be masks, vaccination, screening, physical distancing, amongst others. When prevention strategies are consistently and correctly used, the risk of transmission of COVID in the school environment is decreased. And the use of multiple strategies, i.e. layered prevention, provides even greater protection. So it's really hard to know the specific condition that one may have, and obviously what preventive measures the facility is using. But if a parent or caregiver has concerns, especially surrounding underlying medical conditions, which may put the child at risk for higher risk from COVID, absolutely discuss it with your medical provider and look at the risks and obviously the benefits of going to school.
Okay, thank you. Dr. Davis, we're going to come back to you for a couple of questions. Your next one is the vaccine effective against the Delta variant, and how can the vaccines help prevent more COVID variants in the future?
Great, yes. So all the vaccines are effective against the Delta variant. They are at least 80% effective against infection, preventing infection, and more than 90% effective in preventing hospitalization and death. So that is great news. And how the vaccines can help prevent more COVID variants in the future. The big one is for people to get vaccinated with the vaccines that are out there now, because that's how variants occur, right? It's when you get infected and then the virus is multiplying in your body and picks up all these little mutations and changes. That's what a variant is. And so if we stop that process by getting vaccinated, then we stop a new variant from happening. The other thing that we can do is if a variant that doesn't respond to the vaccine as well should arise, we can do a new version of the vaccine like we do with the flu vaccine every year to deal with the new basically flu variants. We could do that with COVID too if we needed to. But what we really like to do is have as many people vaccinated to prevent the variants from occurring in the first place.
Absolutely. Okay, and then the next one, should adults who have received one of the 3 vaccines be very concerned about getting the Delta variant? So I'm going to ask you this one in a series because there's like 3 parts to this one question. So we'll just start with that one. Should vaccinated adults be concerned about getting the Delta COVID variant?
So vaccination is really, really protective. And so if you're fully vaccinated, your chances of getting infected with the Delta variant or another variant is really, really low. So it's less than 1%, like 0.1 to 0.2%. So yeah, you're very well protected, and especially against hospitalizations and death.
Okay, great. And then another piece to this question, are we still protected if we got the vaccine early on, like when it first came out and was approved in December or January?
Yes, so the data is showing that the immunity is still good. So even though you were vaccinated in December or January, you still have really good immunity. And so a very low chance of getting infected with Delta variant or other variants.
Wonderful, great news. And then the last piece to this question, do we need to avoid family members who are coming from out of state who have been vaccinated? So they're vaccinated, they're coming from Oregon to California.
Right. So your risk, if two people are fully vaccinated, the risk of one passing it to the other is pretty low. So, I would say in general, just a general statement that you don't need to avoid that person. Of course, every person has to kind of take their own medical conditions into account. So if you're immunocompromised, if you're much older, if you have underlying medical conditions, and by immunocompromised means like maybe you had an organ transplant, or you have you're on dialysis for kidney disease, or you have chronic liver disease, or you're on some medicines that usually you'll know because your doctor will have told you that this makes you immunocompromised. So if any of that, or you have underlying medical conditions, you may want to be a little bit more careful, wear a mask, do things more outdoors. But in general, no, if you're fully vaccinated and the person who's visiting you is fully vaccinated, then you guys are both pretty well protected.
That's great news. Okay. And then one more for you, Dr. Davis. Why are other vaccines required for children to enter school, but the COVID-19 vaccine is not?
Thank you for that question. So vaccines in general, it's the state who makes the determination whether a particular vaccine, say the measles vaccine or what have you, is going to be required in order to attend school. And so that's really, it's the state who does that process. The vaccines are safe and effective, as Dr. Say mentioned, for those who are 12 and older. But, it's a process to decide whether a vaccine should be required for, or mandated for any certain particular environment. And so right now, the state has mandated that healthcare workers should be vaccinated, and people who work in other high-risk settings, and then also workers in schools. So we'll have to kind of see, where the state ends up going as far as making vaccines mandatory for students in school.
Okay. All right. Dr. Brown, we're going to go back to you, and I think you're going to appreciate this question because you can reinforce some of your messages. But the person writes in, kids are bound to get the common cold when school starts up. A fever on a cold lasts a few days, and a cough can last weeks. Is there a plan for kids that have similar symptoms to COVID? Will those kids have to stay home?
So yes, thank you for the question. And it does fall in line with things I've said already. I'm happy to say them again. We know that students get colds, it happens. What we are asking is that when someone has the symptoms of COVID, which could be any cold-like symptom, that they test for COVID. If they can provide a negative test, then once they are symptom-free, they are welcome to return to school. If they are positive for COVID, they will need to remain home for 10 days or until their symptoms have been gone for 24 hours. And if they are just with cold symptoms, but not with COVID, then once their symptoms are gone, they are welcome to return. So there's a message here that is, please stay home if you're sick. However, we want students to be in school as much as possible. We just need to work with the community to make sure that we're being very safe in any possible exposures.
Great, thank you. And kind of one to tag on to that, what is the plan for educating children when they have to be quarantined due to exposure but are not actually sick themselves?
Right, so it'll be based on the circumstance. If there's a small number of students that need to quarantine within a classroom, they will be provided with work that they can complete while they're home. That will be provided through asynchronous lessons. In the event that we needed to quarantine a whole classroom, then we would have a plan for how to provide virtual instruction during that time, if that were to affect a whole class. So we're working through the various scenarios that will happen We're aware of what some of them are. We expect that as fall begins, there will be some circumstances that come up that we need to consider a new path. Our focus will be to continue to educate students as much as possible, given the need to keep everyone safe as well.
Okay, great. And then just a little more on exposure and quarantine. What will the quarantine protocol be if there's an exposure at school? I know you talked about kind of an individual, like smaller group or even a whole classroom. So what's kind of the protocol?
Sure. So we have we've had an opportunity to practice our contact tracing in last spring and certainly during summer. And so in the event that there's an exposure, we contact trace for around the people that the person has had close contact with. Close contact continues to be defined as less than 6 feet of space for more than 15 minutes. We notify those close contacts. If those close contacts have been vaccinated, they do not need to quarantine. If they've not been vaccinated, then the close contacts will need to quarantine. We will also be providing a general notification in the event that there's an exposure on a campus so that the entire school community will know that there has been an exposure. And we work really closely with the health department through these practices. Our school nurses have been wonderful and have become expert in the process of contact tracing, but we don't hesitate to reach to the health department when we need to talk through a specific scenario.
Okay, wonderful. Dr. Davis, we're going to come back to you for one here. What can elementary school and middle school under 12 parents do to protect their children against COVID if they go back in person?
Yes, so the first thing would be for everyone in the household to become vaccinated, if at all possible. That will be very important. And then to really try to have everyone who spends any amount of time around their children to be vaccinated as well. Besides that, so that would be the first one, is vaccination around everyone who can get vaccinated, to kind of make a ring around your children. And then besides that, I would watch, crowded gatherings, especially indoors. So you just kind of want to limit children's exposure to the virus. So that's crowded settings, both indoors and outdoors. Make sure that they're wearing their face covering. Don't let sick people be around them. And then, make sure as much as appropriate that everybody's masking as they should. And then following school protocols is also very important.
Okay, great. And then Dr. Say, I'm going to come back to you. With no vaccine available yet for under 12, can you share patient case trends for ages 0 to 11, rates of hospitalization, and the trends in the severity of the symptoms?
Great question. So the data is somewhat difficult to gather, as not all states report or gather data the same, and many states don't report it out or carve out those under 12 years. What we do know is that children can catch COVID. And fortunately, most are mild or asymptomatic cases, but there are cases of children becoming severely ill from COVID. And unfortunately, there are very relatively rare cases of children dying from COVID-19. All states have seen increases in cases, anywhere from less than 1% to over 16% in children from the end of July to the beginning of this month. Nationally, the number of child COVID-19 cases has increased over this time period. And last week, there were over 93,000 reported cases of COVID in children nationally. They're associated with those increased cases has been an increase in the number of children requiring hospitalization for COVID. And right now, there's really no data to report out on trends and severity of symptoms. But again, remembering that most children will have mild disease if they show symptoms at all. And we're very fortunate in that the rates of severe outcomes from COVID-19 among children do remain low, but there are rare cases.
Okay, thank you. I'm going to have one more question for you. Any correlation between asthma and severe symptoms?
Another great question. We see a lot of asthma in our Long Beach community. COVID certainly can affect the lungs along with many other organ systems. The data that we have suggests that individuals with moderate to severe or uncontrolled asthma are more likely to be hospitalized if they were to catch COVID-19. Those who have asthma under control have less severe COVID outcomes with those with uncontrolled asthma. So it really depends on how well the asthma is being controlled. But definitely if you catch COVID, there may be some increased risk.
Okay, thank you. Dr. Davis, I'm going to come back to you. And this one kind of expands upon the previous question that we had for you as far as keeping kids safe at school who are under 12 and can't be vaccinated. So my unvaccinated 8-year-old is planning to go back to school. Do regular surgical masks, if worn properly, lessen or prevent the spread of the Delta variant? Should she wear goggles or a face shield in addition?
Great. Thank you for that question. So do regular surgical masks lessen or prevent the spread of Delta variant? So basically the source of the virus, so how you kind of give it to other people, it lives in your mouth and in your nose. So it's kind of back here, and that's where the secretions come out at. So when you wear just a face covering that covers your nose and your mouth, you are protecting others from your secretions, and you are also the mask also protects you from other people's germs getting into your nose and into your mouth. So it's really about how the mask is constructed. That's what provides the best protection. And surgical masks, because they are more regulated, they're more standardized. So you kind of know what you're getting. But that doesn't necessarily mean that it's necessarily better. I think the things that are important are that the mask is multiplied. So you want more than one layer, 2 or 3 layers. You want it to fit over both your nose and your mouth. It helps if it has that little metal part that goes over your nose. It helps with fogging and it prevents leakage. That's the other thing about the mask is you want something that's well fitted. That's really important. So you don't want a lot of gaps. So you just kind of want to use whatever mask you end up with, whether it's a surgical mask or it's a cloth face covering. Just make sure it's kind of covering everything. You don't have a lot of gaps here where air can flow in or out. It's better if you have ties rather than just straps because you want to be able to fit it to your face. So that's what I would recommend as far as masks go. And usually, just normally, we don't necessarily recommend goggles. So usually when we recommend eye protection, which is goggles, is for healthcare workers who are working with patients who, because of what they're doing with that patient, they're really exposed to all of the patient's, exhalations. So if they're helping the patient breathe with some kind of machine or, doing something, putting something down the patient's throat where they're going to cough a lot or something like that, then they will recommend that you wear goggles to kind of protect your eyes from those secretions because they're coming at you with this greater force. So for a regular 8-year-old, no, I think a very well-fitting face covering is sufficient. If for some reason a child cannot wear a face covering, they have a medical reason that they're unable to wear a face covering, then what we recommend is a face shield. So that'll cover your forehead and go down. That's attached to a drape so that you kind of tuck in your shirt. So there'll be a face shield and then a drape to try to keep those secretions from, again, kind of coming out.
Great.
And they all work against, they all work against the Delta variant and all of the rest of the variants currently circulating.
Wonderful. Thank you. That's really helpful. Dr. Brown, I'm going to go back to you for a few questions. So the first is, what are the specific filter requirements for central air and heating units? And then as part of that, will air purifiers or other ventilation systems be placed in classrooms at schools that still do not have air conditioning?
Thanks for the question. I've learned more about this in the last year than I've ever learned prior. All of our new buildings have level of filtration that is MERV 16. It's a higher than required level of filtration. In our older schools that have air conditioning, the MERV 13 filtration has been installed, or there are standalone HEPA filtration purifiers that are available to those classrooms that don't have one or the other.
Okay, wonderful. So the next one, this one's a little bit long, but I want to do justice to the person who wrote it in. So Long Beach Unified School District is only offering independent study for families who do not wish to have their students return to in-person instruction. I don't want my son to attend class in person, but I also don't want him to lose his spot at his current school. If I choose independent study for him, is there a plan for online classes in the future? What if I choose independent study and then Long Beach Unified offers online classes later this year? Can a student switch to online class at that time?
So I appreciate the question too. And I'd like to say to this parent or any other who's wondering about the independent study program that we will be providing, we're doing a whole webinar on Monday to answer specific questions, but to address the question that's been asked now, independent study is the option that is available for a family that chooses for their child to not come to in-person instruction. We are not planning for an online program right now, so there would be no question about switching between the two. The thing that would cause us to provide an online program would be if we needed to have a closure. So while we have a plan in place, should we need to do that, I want to be clear in that we're not planning for a virtual option in lieu of in-person instruction this year. But I really encourage anyone who has specific questions around our independent study offering. Our team is putting together a very informative webinar. We've taken a number of questions that we're using to frame that webinar that'll be offered on Monday evening.
That's wonderful. Okay, and then the next one for you, Dr. Brown. Has there been any discussion of educating students, especially elementary school students, outdoors?
Yes, there has been. And right now what we're messaging is that first within our classrooms, we will be using the space maximally. We will be distancing the students as much as we can. If there are 24 students in a classroom, they will be spread out throughout the classroom. So we'll be working to distance as much as possible indoors. We will be encouraging as much outdoor activity and opportunity for learning as is possible. We have great outdoor spaces and we encourage staff to bring their class outside and to maximize that space. We have not talked about outdoor only instruction, but we are really speaking about the possibility of taking a group outside in a different way than may have been done in other times.
Okay, great. And then Dr. Davis, I'm going to come back to you. Why aren't masks being required outdoors?
So the virus that causes COVID-19 is felt to mainly be transmitted through the air. So it's these little particles when you speak or talk or sing that kind of get released into the air. And because they're so light, they just kind of float away when you're outside. So they get really diluted very quickly. They don't stay in one place. They just kind of all kind of float off. And so it's been seen that throughout this pandemic that the risk of contracting COVID is pretty low if you're in an outdoor setting. Having said that, if you're unvaccinated and especially if you're in a crowded public setting with people whose vaccination status you don't know, or you yourself are unvaccinated, it is recommended by the CDC that you do wear a mask outdoors. So there are certain settings, especially like large public gatherings where vaccination status of participants are unknown, where it is recommended that you still wear a mask.
Okay, great, thank you. And then Dr. Say, are there any health risks for pregnant women getting the vaccine?
It's another great question and very sensitive to the anxieties that COVID-19 and the vaccines have caused pregnant and potentially those women wanting to become pregnant. And very timely, the Centers for Disease Control came out this week with the following statement, which I'm going to read verbatim because I think it is very direct to the point and encompassing. So the CDC recommends that COVID-19 vaccination is recommended for all people 12 years and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or may become pregnant in the future. Pregnant and recently pregnant people are more likely to get severely ill with COVID-19 compared to non-pregnant people. So since the beginning of the pandemic, there has been a lot of study around all these topics: pregnancy, breastfeeding, those trying to get pregnant. And one is pregnancy puts the individual at higher risk for severe disease. And it's been shown that COVID-19 vaccines in pregnant individuals can absolutely help protect that individual from severe disease from COVID-19. There are a ton of myths around COVID-19 vaccines and pregnancy and breastfeeding, but the data clearly shows that vaccines are safe in these individuals, and pregnant and those planning on being pregnant or breastfeeding should strongly consider getting those vaccines. They are safe.
Great, thank you. Dr. Brown, I'm going to come back to you for a couple questions.
Sure.
Will the daily health screening not only ask about the health of the children, but also ask if anyone in the household has active COVID-19 or is actively quarantining for a COVID exposure?
So it is not our plan to do daily health screening at school. We ask families to conduct those screenings at home prior to sending their children to school. Our messaging will include questions about the symptoms that would be aligned with COVID-19. And one of those items is if anybody in the home is exposed or is positive with COVID at the time. So yes, we will be addressing that. But again, we ask our community to really join with us honestly about what their symptoms and exposures are, because we are all on a bit of an honor system as we return to school and bring many people together.
Okay, great, thank you. Next one, although I understand that the school district is not requiring social distancing in the classroom to allow all students back in the class, why isn't social distancing being implemented while the students are outdoors and there currently is no masking requirement outside or while eating?
I think Dr. Davis gave a great explanation of the lowered risks that are associated outside. And we're really following the guidance of the California Department of Public Health and the Long Beach Health Department that says that mask use is not required outdoors. The other thing that feels important to mention is that one of the things we know makes a complete school experience is to give students opportunity to be outside, to move their bodies, to have some fun outdoors. It's extremely difficult to distance children who are outside together. So we will be doing some teaching around how to keep as much distance as possible, but we won't be formally requiring distancing as they're outside together.
Okay, thank you. Dr. Say, I'm going to come back to you for one more question. How can you explain the mask mandate to children? Is there any mental health measures involved here?
That's a great question, and I think it's being transparent with your child and explaining it in obviously an age-appropriate way. There will be different ways to explain it to the different age groups, but that it's something that everyone is doing. It's there to protect them. It's not there to hurt them, and that to reassure their fears and see what fears they have. Very appreciative that children, this is something potentially very new to them, But we found that most children, when you explain it to them in language that is appropriate for them, they're very accepting of it and willing to wear those masks and don't have a tremendous amount of anxiety. That's what I would recommend.
Okay. Thank you. And then we have one more question. We've gone through the ones that have come through the chat that hadn't been addressed yet. So I have one more question. We're going to do a little round table to each of you. And we'll start with Dr. Davis on this one, and then we'll go to Dr. Brown, and then we'll finish with Dr. Say. If your child was in an Long Beach Unified School District elementary school, would you send them to class in person this fall?
So let's see. So I would, of course, I feel that it is very important with the pandemic. I appreciate the question that came up around masking and mental health and talking to your child about that. I feel like it's really important to talk to your child about COVID in general, about going back to school, and about how they're feeling about all of that. So yes, my plan would be to send my elementary child back to school, but there would be a lot of conversation, as there was with the children that I do have, around feelings and readiness and, just talking through things.
Okay, wonderful. Dr. Brown, do you want to take that one next?
Sure, it's an unequivocal yes. I would send my own elementary child back to school, and we welcome all of our elementary children back to school. We've definitely learned in the last year that the benefit of being together in school is as great as any risk that could be associated with it. We will continue to work very hard to do all of the recommended and certainly the required safety measures. And we really are celebrating the arrival of August 31st and as many students as we can return to campus as possible.
Fantastic, thank you. And Dr. Say, I'll let you take that one too.
My children are a little older. I have one in high school. But if I had children of a younger age, I absolutely would send them back. I caveat that with I would make sure everyone in my household that is eligible for vaccines, 12 years and older, are vaccinated. But absolutely, I would talk to my child, make them understand why going to school is important, the best practices that they should be following, but I would feel very comfortable in sending them back to school.
That's great, thank you. So that takes us to the end of the questions that have been coming in. They were a lot of what you all already covered, which is fantastic, and we really appreciate. I just want to check to make sure that nothing else has come in. Tony, we're good. We're good. Okay. So no other new ones have come in. So we do have a couple of minutes. So I'm just going to, if there's anything, Dr. Davis, Dr. Brown, or Dr. Say that you weren't able to share today based on maybe there's a question that you thought of that didn't come up from the community that you would like to share, or just give us some insight of, just take a couple minutes to do that before we end our session.
I can start. This is Dr. Davis. I know that a lot of people have a lot of questions about the vaccine, and I would like to offer my email. It's anisa.davis@longbeach.gov. If you have questions as you are making your decision, that we would be happy to answer those. The vaccine technology is not new. I know this vaccine seems new. It was done quickly. The reason why the vaccine was done quickly was because the technology had been in the works for over a decade. And everybody in the world really concentrated on getting a vaccine for COVID-19 because of the pandemic that we were in. So I feel really safe about the vaccine. My whole family was vaccinated. And I understand that people come along at their own rate with becoming comfortable with the vaccine. And so if there's anything that we could do at the health department to guide that decision or help that decision, we'd be happy to do that.
That's fantastic. Thank you. And thank you so much for sharing your email and offering that up to people. I'm sure they'll really appreciate being able to have that resource. Dr. Say, you want to go next?
Yeah, I'd just like to carry on with Dr. Davis's statement. There's a tremendous number of myths on the internet about vaccines. And as Dr. Davis outlined, the technology has been around for a long period of time. There have been over 4.5 billion, a billion with a B, doses of vaccine given around the world. No vaccine is 100% perfect, and there have been some side effects in individuals, but at a very, very, very small rate. The vaccines are safe. COVID-19 is a serious disease. It can cause serious illness. It can cause death. I encourage anyone that is still waffling as to whether to get a vaccine, please do your research. Become educated. Reach out to Dr. Davis. You're welcome to reach out to me. And I'm more than happy to answer your questions. They are safe. They will protect you against COVID-19. And it's this disease, this virus is not to be taken lightly. Thank you. Thank you,
Dr. Say. And Dr. Brown, we can end on you if there's anything else that you want to share. I know you talked about your webinar that you all are doing next week, or if there's anything else that you wanted to share.
No, just gratitude for this opportunity. I find that every time we can offer information, it's both helpful and prompts more questions. So we have some great resources here to continue to engage with our community in questions. And we're looking forward to August 31st and working really hard to be completely prepared to welcome our students back as a whole group to a space that they haven't been in together for a really long time. So I want to also say that a lot of our preparations are around the emotional wellness and the sense of safety that we want students to have, emotional safety, not just health-related safety, as they return. Our teachers are really wonderful and very knowing of their students. And so we've been talking about just the social emotional component of what this experience has been like for many students who may be entering into a space with others that they haven't been in for a really long time. So we're excited and counting down the days.
I bet. That's so important. Thank you so much to all of you for all that you do and all that you have done over these past 18 months in particular. We really appreciate it, and thank you to all of you out there who joined us for this really important conversation. And we look forward to continuing the dialogue with all of you. Have a good night.